Generic medicines, celebrated for the potential to provide affordable healthcare solutions, have emerged as a crucial tool in confronting the global challenges of healthcare accessibility and cost. In India, the Pradhan Mantri Bhartiya Janaushadhi Pariyojana (PMBJP), a government initiative championing generic drugs, aspires to ensure the vital medications are within reach of all citizens. Yet, despite its noble intent, the program faces formidable obstacles that hinder its effectiveness in making low and middle income individuals benefit from affordable medicines. Hello everyone, my name is Janaushadhi and welcome to HW News English. Generic medicines assume a pivotal role by making healthcare more budget-friendly through unbranded versions of pharmaceutical drugs that match the efficiency of their branded counterparts. Manufactured at a lower expense, they expand access to life-saving treatments. The World Health Organization (WHO) has uncovered that medical expenses in India constitute a considerable part of household health spending, often propelling families towards poverty. The PMBJP's initiation aimed at diminishing medication costs by up to 70%, thereby lightening the financial load on patients. Nevertheless, the execution of the PMBJP is not devoid of challenges. The availability and accessibility of generic medicines show disparity across diverse Indian states. A significant impediment faced by the PMBJP is the scarcity of Janaushadhi Kendras, the outlets for generic medicines, particularly in states like Maharashtra and Jharkhand. Despite these states harboring sizable population, the number of Kendras is disproportionately low, resulting in a substantial gap in the accessibility of economical medicines. Data unveils that Maharashtra, India's second most populous state, has just one Janaushadhi Kendra for every 1.71 lakh residents. In contrast, Jharkhand's coverage is even scarcer, with one center for every 3.7 lakh citizens. Conversely, states like Karnataka, Kerala, and Tamil Nadu, with smaller populations, boast a more extensive distribution of these centers, underscoring stark disparities in medication accessibility. This situation raises questions about coordination between state and central governments. While the program's goal of widespread medicine availability is commendable, the uneven distribution of centers necessitates collaborative efforts for ratification. Additionally, a pressing issue lies in the lack of pharmacy education among the pharmacists stationed at these centers. Often, doctors prescribe medicines using brand names instead of generic ones due to insufficient knowledge. Pharmacists unable to differentiate between molecules and brand names inadvertently dispense specific medications. Furthermore, Janaushadhi Kendras face challenges such as enhancing stock monitoring, ensuring a steady supply of generic medicines, augmenting pharmacist training, and tackling the problem of generic with short shelf lives. To extend medicine availability beyond streets to train travel, the Railway Ministry has introduced Pradhan Mantri Bhartiya Janaushadhi Kendras at railway stations nationwide. This endeavor not only aims to provide quality medicines to travelers and station visitors, but also generates employment and entrepreneurial opportunities. India's drive to promote generic medicines through the PMBJP holds immense promise for offering affordable healthcare solutions. However, addressing challenges like limited accessibility and availability is imperative for achieving the program's intended impact. In his Independence Day address, the Prime Minister revealed the government's plan to elevate the number of Janaushadhi Kendras from 10,000 to 25,000 across the country. While this is a commendable step forward, collaboration between central and state governments is crucial to pinpoint regions requiring additional Kendras and those that are adequately served. This strategic approach could mitigate the imbalanced Kendra to population ratio. Concurrently focusing on training and educating medical practitioners and pharmacists during the expansion of Janaushadhi centers is vital to ensuring accurate medication provision. In conclusion, the success of the PMBJP will not only bolster healthcare accessibility, but also alleviate the financial burden of medical expenses on Indian households. Collaborative endeavors, education, and strategic expansion stand as vital components in realizing the program's potential to transform healthcare affordability across the nation. That's all for now. For more such news updates, follow HW News English. Thank you.